into the month of October, and October is known to be a breast cancer awareness month. I'm Dr. Amulya from Amulyalabs, and I'm going to tell you about the latest screening protocols for breast cancer. This is an important topic as 1 out of every 28 women amongst us is going to suffer from breast cancer in her lifetime. And these are statistics from our country, and that's India. So what's breast cancer? Breast cancer is an abnormal growth in the breast. It starts from a number of cells, and these unwanted cells keep on growing into the normal tissue and can spread all over. The first place it goes to is the lymph nodes in your axilla. Most common, it can go to lymph nodes along in your chest, it can go to your chest wall, or it can go anywhere else. That is when we call it an advanced breast cancer. The endeavor of all healthcare providers is to detect your cancer early. We are lucky to be born in a country which provides absolutely free healthcare. However, if your cancer is detected late, the government has to spend much more in your chemotherapy, in your radiotherapy protocols, and you too have to suffer more, and chances of your longevity also decrease. Therefore, the focus of healthcare providers and our government today is to detect the breast cancer early. Cancer which is detected early is about 90% curable. Breast cancer screening protocols are separated into two types of patients. Those at an average risk, like you and me, where there is no family history, and the others who are at a higher risk. And these patients usually are those who have got a family history, are known to have certain genetic mutations. I shall not touch upon the high-risk cases today, and I shall talk about the screening protocols which are advised by the American Cancer Society, the WHO, as well as the CDC for average risk women. And those could be you or me. So when do we start screening? As per the advised protocols, from 25 to 39 years of age, one should carry out two things. One is to be aware of your breasts. By that we mean that look at yourself in the mirror and look for any changes in your breast, shape, size, any contour changes, any changes of the skin. Check out any changes on your nipple, any kind of a discharge, especially if it is only on one side, any itchiness that you feel. Most breast cancers are detected incidentally while women are bathing, scratching, or shaving. So be aware of your breasts. And if you find any changes, go to your healthcare provider, your doctor, immediately, who shall further order some tests and carry out whatever is required further for you. The other thing to do is every 1 to 3 years, go to a doctor and get a clinical breast exam. So no longer do we depend upon self-examination. Go to a doctor and let the doctor examine you for any lump. And that examination usually is of a definitive type. Self-examination has not found to be that fruitful as when doctor examines you. So up to the age of 25 to 39 years, be aware of your breast. Get a clinical breast exam done by a doctor every 3 years. Now after 40 years, it is recommended that you get a mammogram. It is a procedure which is required every year from 40 years to 54 years to detect your cancer as early as possible. So what is a mammogram? Mammogram is a simple X-ray of the breast. It helps to detect cancers very early, even when you cannot feel them. Leave alone you not feeling them, even the doctor does not feel them. So they have found to be very useful in detecting breast cancer early, and the surgery involved may be very little, causing you very little and few problems, and you can get rid of the cancer. So that's a mammogram. What do you have to do to prepare for a mammogram? It's usually a radiology procedure. There's an X-ray involved in it. There is a technician who's specifically trained in taking mammograms. The procedure basically involves compression of your breast between two steel plates for just about 30 seconds. You might feel a little discomfort, but it's very, very little. So it's not a big deal at all. So that you get the least amount of discomfort, try to schedule your mammogram a week after your periods if you're premenopausal. Just near the periods is the time when your breast might feel a little tender and you might feel more than usual amount of discomfort during a mammography. So the best time to get a mammogram done is 1 week after you're done with your periods if you are premenopausal. Of course, if you're postmenopausal, you can step in at any time. So that's what a mammogram is. So what is it? What you should do? You try to wear a two-piece dress so that you just have to remove your top. Do not put on any deodorant, powder, or any ointment, because they can show up in the mammogram and confuse the person assessing the mammogram. Rarely you might be called back to double check on any finding that may be visible on mammogram. If something does come up on a mammogram, do not worry, it may not be cancer. Most of the findings which we find on mammogram are benign. Benign means they're not cancerous. However, if there's anything suspicious, immediately you'll be worked up to rule out cancer. So that's for a mammogram. Also remember, if you have got a mammogram done earlier, do bring along that film and report so that the doctor or the radiologist at this time can compare your this time's radiological picture at mammogram with the one which is seen earlier. Do bring along your earlier mammogram so that it can be compared with what was seen at an earlier procedure. It helps in reassessing. At this point, I would also like to let you know that today we have 3D mammograms available. It is a better procedure. You can check out a center which has a 3D mammography available. It brings out a more clear picture of your breast tissue. Hence, it is recommended that a mammography should be done after 45 years of age every year for sure, as well as a clinical breast exam should be done every year. So two things to be done: a clinical breast exam which your clinical doctor will do, and a radiologist who will do your mammogram. It's to be done every year till 54 years of age. It can be done later after 54 years of age till about 10 years of expected survival of a lady. Although it is very essential to get this done after 45 years of age, it is recommended that you should start off at 40 years of age itself. It decreases mammography, as per evidence which we have at research today, decreases death from breast cancer up to 30%, which is a great deal. I would also like to stress upon the fact that in spite of getting a mammograph and a clinical breast exam every year, continue to be aware of your breasts, because you can get the cancer anywhere between these scheduled times. Breast cancer, if aggressive, can just start off and spread along within a month itself, and might increase to sizes which might need much more extensive treatment, which all of us want to avoid. That's most about the screening protocols. And there are other lifestyle measures which you should follow. And there are certain lifestyle changes too which are advised, which can prevent breast cancer. And this is evidence-based on research. So the changes which are advised: that after menopause, live an active life, eat nutritious food, carry out about 75 minutes of vigorous exercise in a week, try not to increase weight, and decrease your alcohol or absolutely abstain from it, which is even better. Avoid hormonal replacement therapy after menopause. Try to get into menopause in a natural manner. I think I've covered most of the screening protocols for women at an average risk. Thank you from Amulya Labs. Stay healthy.